The other thing that can happen is the words that you want to say are on the tip of your tongue and you're unable to express yourself. And again, that's because this little area right in here called Broca's area, number 44, we talked about it earlier, if that's not firing well, you have trouble expressing what you want to say. The other thing is irritable bowel syndrome, constipation, diarrhea. The reason why that happens is because the lower brainstem, there's a nerve that comes off of that called the vagus nerve. And if that nerve is not firing properly, you can get bowels that don't function properly. So that's very important. The other thing is chronic pain. And I save that for last as far as the symptoms of fibromyalgia. But chronic pain, that's the hallmark of fibromyalgia. The reason why that happens is when the upper brainstem is firing too fast, it sends messages down the spinal cord to an area called the IML, the intermediate lateral cell column. And in that area, that's where the sympathetic nervous system resides. And when that's firing too fast, it sends messages out to your adrenal glands. And your adrenal glands sit right on top of your kidneys. And when they're going too fast, they're going to secrete cortisol, but they're also going to secrete something called catecholamines and norepinephrine. When that's happening, and when you're getting too much norepinephrine into your bloodstream, norepinephrine will irritate the small nerve fibers in your body. They're called C fibers. And when they're firing too fast, they're the ones that control pain. And so if you got too much norepinephrine flowing through your bloodstream from this high-firing upper brainstem firing down to that IML, one day your neck may hurt. The next day the bottom of your feet may hurt. Your back may hurt. And you get this pain that seems to be all over, kind of like having the flu. You have this achiness, and that's the hallmark of fibromyalgia. So what I want you to know is I want you to know that what I call the 3 R's of fibromyalgia. Number 1, fibromyalgia is real. Okay? Number 2, fibromyalgia is reversible. And number 3, fibromyalgia is not reversible with drugs. Let's talk about number 1. Fibromyalgia is real. Fibromyalgia is in your head, okay? But it's not in your head the way you think most people think that it's in your head. Fibromyalgia is not a psychological problem, meaning it's not in your head that way. What I mean is fibromyalgia is in your head, but it's actually a physical problem with the way the brain is firing. So it's real. Don't ever let anybody tell you that it's all in your head. Okay? Let them know that you're right. It is in my head, but fibromyalgia is a physical problem. So that's number 1. Number 2, fibromyalgia is reversible, but it's only reversible if it's treated neurologically. Okay? Most doctors are not even looking at the neurological cause for fibromyalgia. And number 3, fibromyalgia is not reversible with drugs. Most doctors are just putting patients on drugs with fibromyalgia. The average patient, and this has been studied, the average patient with fibromyalgia has had at least, or tried at least 10 different medications, and they've also been to at least 10 different doctors looking for the solution. Fibromyalgia will never be reversed with drugs, and the reason why is there's no drug, no good drug out there for fibromyalgia, and there's no good drug that actually addresses the core neurological problem of fibromyalgia. So, I mean, as far as drugs go, I mean, they put you on antidepressants, they put you on anti-inflammatories, they put you on duralgesic patch, they put you on morphine. Now there's a new drug out called Lyrica. Lyrica, most people are not even aware that Lyrica has been around for years. Lyrica is an anti-epileptic drug, and it wasn't made for fibromyalgia. Now it may help some people, but I have not seen many people that get better with Lyrica. Neurontin is another drug. That's an anti-epileptic, an anti-convulsive drug. It's not really made for chronic pain. That's sort of an after effect that they have decided that they need to use it for. Again, the thing about drugs is this: drugs only mask the symptoms. Now, I don't tell patients to go off their drugs, but as their nervous system starts to function better, they are not going to need the drugs as they go. And you'll see in some of the testimonials that these patients start to get off of the medications. So why does a person have this brain, this high-firing upper brainstem, and what causes the brain to lose its normal firing ability? The number 1 cause is stress. Stress, physical, chemical, and emotional stress are what cause the brain to not fire the way it needs to fire. 50% of people with fibromyalgia will report some type of emotional physical or chemical stress that spurred on the problem. Emotional, they may have a death in the family, they may have financial loss, they may have something that has caused them great stress that spurred it along. Physical stress, car accident, a fall, a slip on the ice where you hurt yourself structurally. The other thing is chemical stress, a very bad flu or very bad infection. If a person is not healthy neurologically and that happens, then they develop some of these chronic problems. Now, let's talk a little bit about stress. When you are stressed out and you have emotional stress, there's a part in your brain called the hypothalamus. And what the hypothalamus does is it sends a message down to the adrenal glands. And the adrenal glands secrete cortisol. And when you secrete too much cortisol, cortisol gets up into the blood supply to the brain, and cortisol is toxic to brain. So when you have enough cortisol, what that will do is it'll start to cause a decreased frequency of firing of the brain itself. If you've got poor spinal health, over time that causes the cerebellum not to fire very well. Now, a lot of people ask me, is fibromyalgia genetic? Is there a genetic predisposition for fibromyalgia? There has been no research out there that states that fibromyalgia is a genetic problem. However, I will tell you that I have seen mothers, daughters, and grandmothers that all three of them have fibromyalgia, and they come into my office, all three of them together. But there really is no true studies out there that say that fibromyalgia is caused by genetics. But I do think there may be people that are genetically predisposed to having a neurological problem or being less adaptive to stress. Okay? So fibromyalgia is a neurological condition, and in our office we're not just going to give you some new medication. We're not going to give you some secret vitamin. What we want to do is we want to look at the brain and nervous system. We want to find out why you have the fibromyalgia, because the brain is the cause of the fibromyalgia symptoms. You may be feeling it in your muscles, but the problem is in the nerves. So what we want to do is we want to look at the brain and nervous system, because remember that high firing upper brainstem can cause insomnia, it can cause chronic pain, it can cause you to have irritable bowel syndrome. So what I'd like to do now is I'd like to take you out to one of my treatment rooms, and what I'd like to do is I'd like to talk to you about the exact treatments and the exact neurological testing that we do so you can understand why we're so successful in treating fibromyalgia. Okay, so we're here in the therapy room, and as we talked before, what we want to do in our office is we want to offer a neurological solution to fibromyalgia. So what are we going to do? Well, the first thing we're going to do when somebody comes into the office, again, like I said, we want to do a very thorough consultation. Remember, our treatment philosophy is to treat the individual, not just the diagnosis. So we want to sit down and we want to understand what you've been going through. We want to sit down and understand how this has been affecting you, like I said before, and we really want to understand you. We want to look at your MRIs, we want to understand any x-rays, anything that you've had, bring them in with you. But then from there, what we're going to do is we're going to do a very thorough neurological exam. It's going to have some of the standard things that a neurologist would do, but we're also going to do some very specialized tests. So what I'm going to do now is I'm going to talk to you about some of the tests that we're going to do in the office when you come in with fibromyalgia. So the first thing we want to test is that cerebellum, which is the back part of the brain. And the way we test that is we're going to do some standard cerebellar testing. So one thing we'll do is we'll have you stand with your feet close together, and we'll have you close your eyes, and we'll determine and see, are you swaying from one side to the other? Patients with fibromyalgia will tend to sway to one side versus the other, which means their cerebellum is not firing very well. The other thing that we do is we do finger to nose. So we're going to have you stand there with your eyes closed, and we're going to see how well you can touch your nose and see if there's any shaking in the hand, if you have any tremors, if you're having trouble actually finding the nose. Remember, the cerebellum controls smooth movement.